Is your hip pain actually coming from hidden TFL irritation? The TFL muscle is right here, right in the front of the hip, kind of off to the side, where your front pocket would be if you had on pants with a pocket right here. That TFL muscle, it stands for Tensor Fasciae Latae, by the way, and it's a Latin name, but it's an important muscle because it is part of the IT band. It is within the IT band, which is a band of connective and neural tissue that starts up here on the side of the hip, on the outer part of the hip, and it goes over the side of the thigh, all the way down past the knee. And it's something that can be involved with IT band syndrome. That's probably the most common way that you hear about it. But TFL irritation in and of itself is not really a formal diagnosis, but I find it to be a problem in so many people that have hip pain. And this is from all sorts of hip pain problems like bursitis problems, tendonitis issues, and even osteoarthritis problems inside the hip joint. The reason why TFL irritation happens is because the muscle gets overused. If you look at my muscle model here, this muscle model falls apart really easy, so let's be careful here. You're looking at the thigh right here, the knee, here's the foot. The TFL is kind of blended with some of the other muscles in the hip right here. It's actually blended with the gluteus medius. And then here's the glute maximus on the backside of the hip. So the muscle imbalance that happens that causes the TFL, that's kind of more on the front than anything else, to be overused and become irritated is that you don't have good activation, good use, and good strength of the glute maximus muscle back here. And as a result, you begin to find other muscles in your hip to produce stability and movement in the hip. And TFL loves to take over. It loves to get involved and just take over whenever any other hip muscles are slightly not doing their job. And it'll take over for as long as it can. And because it's so small, it's a tiny muscle. Let me show you here. That's the glute muscle. It's kind of a thick muscle, glute maximus muscle. And then like I told you, the TFL is combined with the glute maximus. So really it's just the tiny sliver on the front right there. I'm covering up gluteus medius. Sorry, I said gluteus maximus, but that's gluteus medius right there. And there's your gluteus minimus deeper to that. So the way that TFL works is it's mainly in a hip abductor. It's moving your leg outwards to the side. Let's go to the skeleton. It's doing this motion right here and some hip flexion. And it can also help with hip internal rotation. It could turn your leg inwards. And so if you don't have good glute activation on the back, which that muscle helps to move your leg back, hip extension, and rotate your leg out, it does help with some abduction, but mainly backwards and outwards rotation. TFL will begin to cause your hip to move forwards and inwards, and it'll cause you to use to rub the bursa too much here. It'll add a lot of excessive compression to the inside of the hip joint, which feeds into arthritis if you have this problem going on for decades or at least years. And you know what? It's the most common pain symptom that I hear people report. They'll say, I have pain right here, right here. It's tender. And I think that a lot of healthcare professionals out there mistaken TFL irritation, overuse, for IT band syndrome up in the hip, or bursitis right here on the greater trochanter, the trochanteric bursitis, tendonitis, even hip osteoarthritis symptoms. You might have even been told that you have hip arthritis pain when in reality it's TFL irritation. And just because you have arthritis on your x-ray, they're connecting the two and saying that's hip arthritis pain. But if we solve for the overuse issue, for the compensation, for the reason that the TFL is being used too much, even though you have hip arthritis, you might get rid of this pain altogether because you can calm down the TFL irritation by getting better use of your glute maximus muscle on the backside of your hip. It's often thought that the TFL muscle is weak, and that might be a reason why it's becoming painful for you, but it's not the case. It's true that it might come off as weak, but it's not weak because it's not strengthened. It's actually being overused. And when a muscle gets overused, it gets burnt out. Just like you get burnt out if you're doing too many things for too long a time, so does your TFL. And after a while, it starts to give up and say, I can't work as hard as you need me to. I'm not getting the help from other muscles in the area that should be pulling some weight too. And it's the big glute maximus that it's their fault. And you need to fix that in your body. So if you can get the glute maximus to wake up, because some people can't even contract their glutes, if you can get it to first wake up and then get it to work without your TFL taking over, then you're moving in the right direction towards calming the TFL down. Because if the glute max is working when it should, like when you get up out of a chair, it should be glute max driving you up, not your thighs and hip flexors. Definitely not the TFL. When you're walking, it should be glute maximus getting tired as it's propelling you through the walking pattern. When you're doing any sort of squat-like movement exercise, any sort of lunge type exercise, you should be focusing on using your gluteus maximus muscle on the back of your hip, not TFL. If you're doing exercises that are isolating out the TFL, like sideways type motions, like standing abduction is one of the worst exercises to overwork your poor TFL and feed into this problem where it becomes overused and weak. And then you have pain right here in the front of your hip. And healthcare professionals very often are thinking, well, it's weak, let's work it out. That's the very superficial thinking, which makes sense on an elementary level, but when you think it through better, if you strengthen the glutes on the back, the TFL starts to quiet down. It starts to not have to be used as much. Then that causes the irritation levels to go down, and it normalizes the pressures inside your hip joint to help arthritis symptoms. It takes pressure off the bursa on the outside. It takes pressure off the tendons right here where the TFL, gluteus medius, gluteus minimus all come in on the side here where you might get tendonitis. People get hip flexor tendonitis in the front because those muscles are being overused along with TFL. If we can get the glute maximus on the backside of the hip to do its job and extend your leg, be the main driver in pushing you through walking whenever you're moving, then you're on the right track to calming down that TFL irritation and getting rid of hip pain that keeps bugging you day after day, week after week, months and years after years as well. This is the root problem, is weak glute muscles causing overuse in that TFL. Fix that and you're fixing so many other problems. If you have TFL irritation and are suffering from pain inside your hip joint, you might also have a torn hip labrum. I want you to check out this video next to figure out the top 6 exercises for naturally healing a painful torn hip labrum.